The topic of aging is dear to my heart. I'm very involved with these subjects on a daily basis for my job, and working for the elderly has become my passion. In the early 19th century, a need for long-term or aging care was vastly growing. Many church groups started homes to assist, but these homes were pretty nice, but there were still entrance fees and letters of reference showing you had good moral character required. For those who could not meet those standards, they ended up in asylums with the poor, sick, mentally ill, developmentally and physically disabled, and some with orphan children. The care and living standards were not adequate. After Social Security was formed, these types of homes slowly closed and were pretty much abolished by the 1950s. State and public institutions started to open, and by the mid-1950s there was a survey practice in place put in by the Medical Facilities and Construction Act to ensure quality standards were in place and being met. In 1965, the Medicaid and Medicare Act was in place, and the nursing home industry was booming. In 1972, Social Security reforms set a list of standards or regulations for long-term care facilities. Over time, standards changed, and by 1987, the Nursing Home Ombudsman program was added to assist residents and families with complaints, disputes, and ensuring quality care. There are many stereotypes and stigmas that surround long-term care and nursing homes, such as they are all dirty and smell like urine and feces. The government continues to change and adapt standards to try to meet the very diverse and changing needs of our elderly population. Locally, the Ohio Department of Aging put forth person-centered care initiatives that would help change the face of long-term care in Ohio. They started their program in 2011 by selecting certain long-term care facilities to participate. The facility I work in was one of them. We were supplied trainings and education in many areas pertaining to improving the quality of life for nursing home residents. We then formed a group that consisted of our social worker, administrator, our ombudsman and her volunteer, and several of our residents' family members. Later, I joined the group as the recreational activities staff. We discussed ways to improve our building, the actual living environments, and care provided. By the end of the program, we were able to update bathing areas to be more spa-like by adding new soothing paint colors and modern fixtures. We installed home-like chandeliers in the dining rooms and selected linen tablecloths and napkins to make dining a more home-like experience. And very importantly, we implemented eye care plans, which puts the person's plan of care in first-person language. I've definitely noticed the positive impact these simple changes have made. In an excerpt from the academic article titled Person-Centered Care for Nursing Home Residents, The Culture Change, written by Mary Jane Corin. The culture change movement represents a fundamental shift in thinking about nursing homes. Facilities are viewed not as healthcare institutions, but as person-centered homes offering long-term care services. Culture change principles and practices have been shaped by shared concerns among consumers, policymakers, and providers regarding the value of and quality of care offered in traditional nursing homes. They have shown promise in improving quality of life as well as quality of care, while alleviating such problems as high staff turnover. Policymakers can encourage culture change and capitalize on its transformational power through regulation, reimbursement, public reporting, and other mechanisms. This is a project that I did with a group pertaining to what is person-centered care and what does it mean to you. The Ohio Person-Centered Care Coalition defines person-centered care as an approach to care that honors and respects the voices of residents as individuals and those working closest with them. It involves a continuing process of listening, trying new approaches, seeing how they work, and changing routines and organizational approaches in an effort to individualize and deinstitutionalize the care environment. I asked some of my coworkers what this meant to them. Some of their answers were quality care given according to the individual's needs, interests, wants, and desires. Always keep in mind what the resident likes and enjoys, and care should always be done in the best interest of the resident. Focusing specifically on the person and what we can do for that individual to improve the quality of their life. Another great explanation of the Person-Centered Care Initiative is a YouTube video called A Conversation with Bonnie and Bev About Expecting Excellence, and it can be found on www.youtube.com. Earlier I mentioned the Ohio Department of Aging. Even more locally is the Area Office on Aging. This very important social welfare agency assists our elderly population with a wide variety of services that ensure the rights, respect, and care for the aging are done properly. Assistance with long-term care services, from home care and assisted living to transportation and mail delivery, are a few things that assist with keeping the residents and elderly population independent in a safe manner. They offer wellness programs to promote fitness and good health, and provide support and assistance in choosing facilities and ensuring all appropriate benefits are in place. This agency plays a very important role in ensuring our elder population is cared for properly.